Welcome back to Beyond Adjustments, where we crack backs, crack jokes, and occasionally crack under pressure. Kidding. That's just me. Today's guest is Dr. Bobby Mozafari, a guy who doesn't just fix pain. He upgrades human performance like a chiropractor / mad scientist. He's the founder of Integrated Sport, Spine, and Rehab, where he helps athletes, weekend warriors, and let's be honest, people who just slept weird and now need a professional intervention. We're diving into sports rehab, injury prevention, and why you should probably stop walking around like a T-Rex after sitting at your desk all day, like me. So buckle up, straighten your spine, and prepare to have your mind adjusted because Dr. Mozafari is about to drop some knowledge bombs. Let's do this. Cue that music. Dr. Mozafari, welcome to Beyond Adjustments. I'm so glad you're here, man.
Thanks for having me, man.
Absolutely. Absolutely. We tried to make this work a couple times, and this one almost didn't happen because I had a scheduling conflict. Yes, it was my fault. But here we are. I'm so glad we made this work. I'm really excited to get into your journey, man. I'm excited to get into your practice. I want to learn more. I want the viewers to understand more about what you do. So I'm just going to go ahead and jump in. Is that cool?
Sure. Yeah, absolutely.
Good stuff. So every practitioner has a story, and yours is a pretty fascinating one. Starting Integrated Sport, Spine, and Rehab must have been a major milestone. But what actually led you down this path? Like, what was the moment where you knew this is what I need to do?
Oh, man. So it's funny, when I was trying to figure out what I wanted to do with my life, like what career path I wanted to go down, I didn't know what it was that I wanted to do. I just knew that I wanted to help people. My mom told me about whenever I think I was like 2 or 3 years old, she was watching like an episode of like 20 minutes or something. And somebody ended up getting, some type of surgery done. Like it was like this revolutionary surgery. And I said something to the effect of, I need to hurry up and grow up so I can help people too. And so I've always had this passion for just like, helping. And so whenever it was time for me to, go to college and try to figure out what it was I wanted to do, I didn't know what it was. I just chose pre-med just because I, figured, well, I guess this is a good placeholder. I'm going to be doing something in health, so let's just go that way.
Yeah.
But I knew that I didn't want to be a medical doctor. I just take 2 and call me in the morning just didn't seem like very fulfilling for me. Being on call and, standing and doing surgeries for hours and stuff like that also didn't really seem like my cup of tea either. I've always just kind of like never really been good at just sitting still for a long period of time. So, I just didn't know what it was I wanted to do. And it was one day I went to, a LAN party, which, some of your viewers and listeners have no idea what a LAN party is. It's whenever a bunch of nerds get their computers, networked together and they play games against each other. And, so I went to a friend's house, and actually it was a friend of a friend, and his dad was a chiropractor, and I didn't really know what a chiropractor was. I knew that one sponsored my soccer team whenever I was a kid, but I didn't know what one did. And I was like, man, it's nice place you got, and nice cars that you have in the garage. Whoops, and I see like the mail says, your last name, like what's your dad do? And he goes, oh yeah, my dad's a chiropractor. I was like, yeah, I don't really know what that is, man. Like, can you tell me a little bit more? And
Yeah.
He's like, yeah, but basically my dad, he helps people get out of pain without using, medicine or, surgery or anything like that.
Yeah. It was meant to be.
And I was like, oh, that's kind of, yeah.
Yeah.
And it's like, that was really cool. I'll look into that. And so I did, and I saw that there's, potential growth, for the future of the
Sure.
profession. Yeah, I went to the Department of Labor Statistics website or something like that. And this was back in like 2001. So,
Wow.
so it showed like a 10-year progression. There was growth, and I went with it, and
Nice.
I went to a chiropractor. I was feeling a little bit of pain. I was serving tables at that time, and my back was bothering me. Went to a chiropractor. He helped me feel a whole lot better, and I said, "Okay, cool. I dig it. I'll go ahead and do this."
Mm.
While I was in school, I realized opinion than the vet with regard to based on the things that we've learned.
Mm-hmm.
And once I graduated, I kind of had I decided I was just going to do my own take on it. Right. I'm going to kind of like go with what it is that I feel is more right. And so I tried doing that. It was really hard. My first practice was in the St. Louis area, and St. Louis area is pretty saturated because when the chiropractic school that I went to is in the St. Louis area, Logan. And so the vast majority of chiropractors there at that time practiced one kind of way. And if you were trying to market yourself, you would be best served to market in a way that was, kind of status quo, because then people are kind of really familiar with that. And they'll say, yeah, sure, you're just one of the dozen and I'll go with you. But whenever you try to like, say something different, contrary to what everybody else is saying, it doesn't jive well with a lot of people whenever that's like the majority opinion. So, it didn't survive. And then I moved back to the Maryland, I live in Maryland. So I moved, and that's where I'm from originally. So I moved back. And I worked someplace for a little bit, got a good hang of, some of the things that, I needed to learn, and then started my own practice. I figured other people can do what I can do too.
Right. I love that, man. So speaking of your practice specifically, a lot of chiropractors focus, mainly on adjustments. And you were saying you wanted to take a different approach. Your approach is a bit more comprehensive, I would say. Your practice integrates, from what I understand, and chiropractic, there's rehab, there's strength training, which isn't something, we see in every clinic. Was there that defining moment that pushed you to blend these disciplines, or was it something that evolved naturally? Is it like you were just learning and then it clicked, or what is it that made you kind of lean towards this blend of disciplines?
So I don't know, honestly. I think some of it I attribute to just the way my brain works. My parents are both engineers, and so they have like a bit of like a mechanical type of mind, and I guess that just kind of, I inherited that. And for me, it was kind of a matter of, like while I was in school, talking about, the subluxation complex and, the misalignment of segments and that kind of thing. It just did not resonate with me. I didn't understand it. It didn't make a whole lot of sense to me. And so I figured that, this is a profession that's, been around for a long time. So there's obviously something here, right?
Sure. Yeah.
But I didn't know what, I didn't know what it was. I mean, it's not massage, but it's something else, and it, makes people feel better. And it's, there are people who have been dealing with lifelong issues and, or like very chronic issues, and have seen tons of different practitioners for the same problem. And then they go and see a chiropractor and everything is, fixed. So there's something there.
Yeah. Yeah.
But it was, it was a matter of kind of like taking a little bit of the perspective that I had of, not really buying it fully into like the subluxation complex, but realizing there's something there that is causing some kind of issue that I'm not quite sure of. But then also blending it in with, the physical therapy that, we learned in school and recognizing, okay, so this is designed to help this, motion and movement and stability and everything. So we work on these exercises for these reasons. And then we do manipulation in these areas for these other reasons. And so how I would classify things like back then was, my perspective was kind of like a blend of, well, you have to do both. Like you can't just do one and not the other. You have to do both, because it's kind of like whenever you like look through a microscope and you're looking through the viewfinder, you have the coarse tuning knob and then the fine tuning knob. You can't just, you can sometimes get like a perfect picture just by using the coarse tuning knob or just using the fine tuning knob. But most of the time you're going to need a little bit of both. And that's kind of how I viewed it is, you have to do something that incorporates movement and stabilizing certain areas, in order to improve things to a significant enough degree that people feel self-sufficient, like
It's true.
they're able to, like they actually got something done, like
Yeah,
they feel better for longer. So that was
that
just kind
makes
of my
sense.
perspective.
Understood. Yeah, yeah. Well, one thing though that stood out is your designation as, and if I'm saying this wrong, please correct me, a certified primary spine practitioner. It's like CERT PSP or something like that.
Yeah,
That's
yeah,
that's a title that not a lot of chiropractors hold.
yeah.
And I guess it would suggest a broader scope of expertise in spinal care. Like, how does this certification shape your, I guess, approach to maybe bridging rehabilitation and performance training?
So that's a really good question. So the program started at the University of Pittsburgh, which now has a chiropractic program. Believe it or not, it's the
Mm,
first state funded, like first state university to have a chiropractic school that is run by a chiropractor. And so they started this PSP program, and it's at the School of Physical Therapy at Pitt. And what it aimed to do was basically help kind of fine tune what it is that whenever people are dealing with some type of spine related disorder, some type of pain that is occurring in the spine, or distal to the spine, even that has a relation to the spine, how do you figure it out? What do you like? How do you know what to do about it really quickly? And then how do you get, some good results out of what it is that you're doing? How do you manage the case? Because spine care isn't just kind of like somebody has an instance of a spine situation. Like 82% of the population deals with low back pain, at some point in
mm,
their life. It's the number one leading cause of disability in the world. So there's something there. Spine care is more of a continuum. You may not have very many episodes at the beginning of having some kind of thing. Then you get treatment, and then it kind of goes away for a period of time, and then it comes back. And then, but the thing is that there's a continuation of this condition that people have, and that's just the normal
mm.
human condition. Like we're not designed to be perfect. I've got grays in my beard and everything like that. And I and in my hair too, and I'm getting wrinkles and stuff like that. Like we're not designed to just kind of yeah, we're not designed to stay young and perfect. We're designed to live as we die. We're designed to live as we decay, and
Hmm.
um and so there are things that happen along the way, and management of that is important.
That makes sense. If you had to sum up your entire philosophy of care in just one powerful guiding principle, what would it be? A
My entire philosophy.
little bit of a challenge question for you.
It is a challenge. I would say my philosophy is whenever possible, you should learn how to fix your own stuff. There should be a degree of self efficacy.
That's actually very powerful. Um, the medical industry itself makes that very hard, like the mainstream medical industry, because they want you to rely on them. They don't want you to ask questions. They want you to take the pills that they prescribe. They want, etc. Right? Like And I think when it comes to the more natural, holistic approach, like the chiropractic and, laser and dry needling or whatever, ask questions there as well. But taking that more natural approach, in my opinion, you're introducing less foreign objects into your body. But then at the same time, you're allowing your body to do what it was designed to do, which is heal
Yeah,
itself when it needs to function.
absolutely. And the cool thing is that we're actually starting to see more of like mainstream medicine kind of shifting a little bit more towards that direction. In the past, it was
A
always,
little bit.
oh, you have pain, take this pill. Oh, you have pain, let's get this injected. Oh, it's still there, let's go ahead and have you go to the surgeon. You know, all that kind of stuff. And what
Yeah.
we're seeing more is a bit of a regression from that, because the most
I
of the
hope
research
so.
that's coming out is saying, yeah, most of the research that's coming out is saying, hey, all that stuff that we used to think, we need less of it. Remember whenever we used to think like surgery, whenever people got surgery, they fared really well with this kind of thing. It turns out not really. And it turns out
Mhm.
sometimes it's worse, but in the majority of cases, you're no better off than doing nothing at all. And we're just getting
Yeah.
rehab. So there's no
Yeah.
real improvement. So why would you spend the healthcare dollars on a surgery that isn't going to be? Let's minimize how many medications you're taking. Let's work on other things. Let's work on lifestyle changes. I need you to see this provider for this dietary thing, or I need you to see this provider for rehab, or I need you to see this provider for acupuncture, or this one
Mm.
for, psychotherapy. So it's, and it makes sense. It makes sense, because if the healthcare model now was, uh, everybody just, let's go ahead and give pills out to everybody all the time. Well, guess what? People need to go back for prescriptions, and doctors have a limited amount of time on their schedule to see people. And you have to see a lot of these people for these medications. So
Right.
it makes more sense. Hey, what can we do to figure out, like, who can I send you to figure out how to do this where I don't need to see you? And I want to see people who actually need to see. I need to see diabetics.
Mm.
You know what I mean?
That's a good segue because I wanted to get into a little bit of the treatments that you provide or that you offer there, because there is a variety, and I would consider some of it advanced, right? Outside of the chiropractic adjustments, right? And physical therapy, you have the less common, which, we're talking about dry needling, class 4, I think, laser therapy. I don't know the different classes, but
Yeah.
I think I read that on your site. And radial shockwave therapy, like all these things, like with so many tools available and at your disposal, how do you determine what's the right one? If Amin walks into your practice and I have A, B, and C, D, and F, and W wrong with me, like what's the best course of action for each patient? How would you approach me with that?
So that's a really good question. So, for example, like dry needling. Dry needling is, and all of these things are, they're a little on the controversial side, just because there is research that supports each one. But then there's also research that says, is it really that necessary? I don't really see the benefit. And so for me, I see it as, listen, if there is evidence to support that this is helpful and there's enough of it,
Mhm.
then to me that outshines the evidence that says that it does nothing at all. Because I see this as
Mhm.
double, like a two-sided benefit, really. Is one, okay, so let's err on the side of it does actually help. Okay. Well then great.
Mhm. Mhm.
Then it actually did help in a physiological way, which has been documented. Let's say that it doesn't help. Okay, well then it didn't help, and you haven't lost anything. You're not harmed as a result of it. You know what I mean? Like you didn't lose out on, like, you're not worse after having had it. So that's one way of looking at it. But the other thing is that a lot of the patients that come into our types of clinics, like, chiropractic, or, non-pharmacological, non-surgical clinics, they're looking for something. Like, they're looking for some type of hope. They're looking for some type of thing that's going to help break up the monotony of pain and feeling of disability
Mm.
that they are coming in with. And, and that's, like,
Yeah.
that's why there are so many different clinics out there that provide services under the same kind of umbrella, but different philosophies. Like you go to, like, there are so many different types of acupuncturists out there. There are so many different types of chiropractors out there, so many different types of physical therapists out there. And it's because we kind of live in this space where there's no set standard, because it's not something that can be easily researched. It's not like, for example, let's take 2 of these and see what happens, you know, in the blood chemistry over time. Let's get a large sample size. Let's get a placebo group over here. Let's get a, you know, let's really kind of study this out. And the placebo group and the, you know, experimental group, they have no idea which one's which. And I don't either, you know what I mean? So like doing all this research, you can see for sure in the blood chemistry or in the results or in the imaging or whatever, what ends up happening. You can't really do that with, you know, physical therapy or acupuncture or chiropractic, whatever. So we kind of live in this space. You know, we don't have anything that is really easy to standardize. Now, with that said, the reason why all of these practices are in existence and still kind of, you know, thrive and have loyal patients and everything like that is because it still works. It's, you know, people still feel the benefit, whether it be a physical benefit, an actual like physical benefit, or a psychological benefit that they're feeling that is manifesting in a physical way. So, you know, it helps regardless. Now, going back to, you know, why would I use one modality versus the other? It really just comes down to, what is it that the research says that, or indicates that it may be the best for? So if somebody's dealing with, you know, pain that is a result of trigger points, for example, like these little kind of like semi-permanent kind of muscle contractions within like the cells and the fibers and stuff, you know, that can cause restored pain in other areas. There's a lot of work that was done, you know, by, you know, some pioneers in Bill, and, you know, they, you know, and a lot of researchers have been able to kind of see and document these trigger points. And they've seen that, you know, whenever, what, you know, a lot of times in medicine, what they would do is they would just go ahead and, you know, inject lidocaine into it or saline into it in order to break those trigger points up. There's not a big difference between if you do that or you stick a needle into that muscle and you kind of break up the trigger point. The pain is alleviated. So that's why, you know, we would do something like that. If, you know, you had some muscle soreness after a bad workout or like a hard workout, or like you pulled a muscle, you know, and it needs to relax a little bit so that it can heal a little bit better or quicker. It'll help you feel a little bit better as you get it done. Another instance is shockwave, for example. I would want to use that for things that have some type of inflammatory, like tissue, like the tissue is inflamed and it's being overused. My perspective says, well, there has to be a reason for why it's being overused. So we have to address the overuse. So, you know, the shockwave helps on, you know, different levels of how it works within the body. But ultimately what I want to do with shockwave is, let's go ahead and stimulate the body's response to healing that tissue. Let's go ahead and increase some of the inflammation in this area where this tissue is still kind of going through this healing process, while simultaneously addressing the reason for why that tissue is being overused in the first place. I've never seen good results whenever you just go ahead and shockwave tissue that is injured and just kind of be like, oh, well, that's, you know, oh, plantar fasciitis, let's just go ahead and shockwave plantar fasciitis without addressing the reasons for why you have plantar fasciitis. You know what I mean? So, so that's an instance whenever I would use that. And then finally, I would use, you know, like a class 4 laser whenever I'm trying to heal injured tissue that doesn't have something necessarily that has like a cause to it. So for example, like, let's say you pulled a muscle again, right? Well, that doesn't have like, a lot of times that doesn't have a cause. Like it's not like there's a cause for why that muscle ended up, you know, being contracted harder than the tissue would have allowed for it to have contracted. So we use the laser in order to try to heal that tissue a little bit faster and help kind of reduce the pain, very quickly. But also it's really good for nerve pain. A lot of times people who are dealing with like a herniated disc or like a tissue, like a nerve injury, like they've hit it against something.
Yeah.
That can, the laser can really help heal the tissue faster. And it can help get people, feeling a lot better and giving them their better quality of life sooner than if they were just to, just leave it alone or just, get massage or, chiropractic manipulation or just exercise. So because it works on a cellular level.
Right. So you mentioned injuries a couple of times. If you could get every listener, right? Everybody that's in earshot of you right now to adopt a simple habit, whatever it may be, to maybe prevent injuries, maintain their peak performance, what would that be?
Man, it's difficult to answer because there are multiple things. There are multiple one things. And it just kind of depends on like, oh, well, I already do that. Well, then there's another one thing. So the main thing is you have to get sleep. You have to get, your 7 to 9 hours of sleep. That is the greatest predictor for reducing injury. Like that's the greatest contributor to getting people to have healthier, tissues and reducing injury. And just kind of like, not, a lot of times injuries happen because you're like in a brain fog. You don't think, like you trip over something that you otherwise might not have, or, you did something boneheaded, right? And if you don't, and if that happens, you just didn't sleep well enough the night before, then, sleep more. But, there are people who they're like, okay, well, I sleep all the time. Like I get plenty of sleep at night, but I still end up with this pain or this injury or whatever. Cool. The next thing I would recommend is go for more walks. If you can go for more walks, get up and go for a walk every day. That really helps out with your health too. There's studies that show that it not only helps, with mental clarity and helps with, kind of sorting out the gunk of the day and having like made up conversations that is very therapeutic, like just kind of like, man, I should have told my boss this. You know what I mean? Something like that. It helps on a cardiovascular level. It really helps reduce blood pressure. It helps regulate your heart rate. It regulates, it helps increase your muscle activity. It helps regulate your blood chemistry a little bit better. Helps with, reducing instances of, pre-diabetic conditions. So there are all kinds of different things that helps. And then finally, I would say drink more water.
Yeah. So I think I know the answer to this. I had someone on the show he treats athletes. It's kind of his biggest clientele as far as his patient log. But I asked him this question. I think I know the answer. I think I know what you're going to tell me. But how do you adjust your treatment approach to meet kind of the diverse needs of your patient? Because you do have, athletes. You've got those that think they're athletes. You've got people like myself who are wannabe athletes. So like, just somebody trying to overcome their, lower back pain on a daily basis or whatever. How do you adjust your treatment approach to meet those diverse needs?
I think first is you have to recognize that every patient is different. Like you just said, everybody's different. There's different groups of people. And, recognizing that not only is everybody different, but every body is different. So you have to be able to, recognize where is it that patient is? Like, what is it that they're trying to do? What is it that they're trying to accomplish? What can't they do? That's really important for them to be able to get back to doing it. And so we have to figure out, how do we accomplish that goal? What is it the thing that needs to be done? That's number one. But then number two is, how do we accomplish that goal? What is it that patient is okay with? Sometimes you come up with a plan and patients are just kind of like, no, I don't really like that. I don't like the sound of that. Or I want a little bit more of this, or I want you to do more of that or whatever. And they kind of try to dictate, the care plan. And you can allow that, for some patients, not completely, but, you kind of give them options. Say, you do a little bit of negotiation. Say, okay, well, I'll tell you what. We will do it this way as long as you do this one exercise at home every day. You know what I mean? Or something, you know what I mean? But ultimately it comes down to, what is it that the patient's goal is, and how do we figure out what it is that the patient needs? What is it that they're most comfortable with? And
Yeah.
also something that, I always make sure that I do with every patient, have them recognize that they have to have skin in the game. They have to recognize that they are part of their own healing. It can't
Yeah.
all just be on me. They have to
Right.
recognize they're with themselves throughout the day. I'm not there all the time. They have to hold themselves accountable sometime too.
Yeah, it's a mental game. I mean, if their head's not in the game, just like any sport or just the game of life, like if they're not putting that effort into it, of course, like they're not going to get anything out of it. But I think a lot of the times it's because of the,
Yeah.
excuse me, because of the confidence or lack thereof that they have in their bodies, right? And I think, people like yourself, practitioners like yourself, can help with that. You can give them confidence in their bodies or in the ability that their bodies have. How do you help patients regain confidence in their bodies when they've been dealing with pain for months or even years sometimes?
One of the things that I think is fantastic with basically how chiropractors of all different kinds are able to get patients feeling better so quickly is because so many patients, whenever they have pain, they feel like they shouldn't do something. Everything, like they're
Mm,
worried, they get scared of doing a thing, picking a thing up or twisting a certain way or whatever. And whenever a practitioner, puts a patient on a table and manipulates their spine one way or the other, it kind of gives that patient a bit more agency and a bit more, it reduces their degree of concern about doing certain things because they're just kind of
mhm.
like, dang, I just got twisted into a pretzel and cracked, one way through the other, and I feel fine. So, maybe I
Yeah,
can pick up, maybe I can pick up my grandkid, and it's not so
yeah,
bad. Maybe I can
yeah,
do this and that, and
yeah,
it's not so scary anymore.
yeah, yeah. I think what happens sometimes is, and I'm speaking for myself, I'm also speaking like on behalf of people in my life that I've seen kind of walk through this. We start creating these almost like borders or barriers or just these thresholds that we think we have, and we start believing that this is our max.
Yeah.
I can't go past this. Years ago, I was into running for a little bit, and I would just run for a mile and then I'm like, "Ah, I can't do this anymore." And I'm like running out of breath when in fact it was my breathing that was off. I
Yeah.
needed to learn how to breathe when I was running. And as soon as I did that and I learned how to breathe, literally you have to teach yourself. I was able to do my 3 point whatever mile. It's a really big mental game at the end of the day that we just need to be aware of. And that said, a lot of people will delay treatment, right? I've seen it. I've done it. Knowing that chiropractic
Yeah.
works, I myself have delayed treatment because I was hesitant, right? But some people are also skeptical. So, like, what's one thing? And this is probably another one of those challenge questions for you. But what's one thing you'd say to someone who's like kind of pulling back and saying, I don't want to start, and they don't even kind of embark on their recovery journey? What would you say to them?
One thing about me is that I'm not really big on trying to sell anyone anything. I'm a I'm
Okay.
I'm just by nature a problem solver. And so, if somebody says, I'm not ready to kind of like embark on this thing and whatever, what that tells me is a couple things. Is one, their pain isn't bad enough. Um, they just don't feel like what they're suffering is bad enough to try something that is different than what they've already tried
Yeah.
and did not work. The other thing it tells me is that they don't recognize that um, like allied health specialists, like allied health providers, like chiropractors, physical therapists, acupuncturists, we're not all the same, because
Yeah.
they're so used to going to doctors and having a history of going to doctors. Have all kind of practiced in a very similar fashion or prescribed a very
Mhm.
similar type of medication. And so they just kind of
Mhm.
think, or like gone to dentists, like you go to one dentist or the other
Right.
dentist and you get your teeth cleaned.
Right.
It's just like, okay, cool. Whatever. but without realizing that there's a lot of nuance between one provider to the other in this space. And so, just kind of what I never try to like argue with somebody about what they are comfortable with. You know what I mean? Like that's their comfort level. But you just basically say, listen, I completely understand. You're not the first person I've talked to who felt that way. I totally get it. But, here's what I would recommend is when it gets bad enough and you've tried other things and it hasn't worked, just give us a try.
I want to segue into the business side and the marketing side of your practice.
Ooh.
I think I mentioned to you that our audience is both, right? You have people like myself that are hungry for the health knowledge. Then you also have DCs that are listening to this podcast that want to learn from people that have been doing it for a little bit and that know what they're doing. So I have a couple questions for you, if you don't mind, kind of to talk about the kind of the business and marketing aspect of it. So integrated SSR, do you call yourself integrated SSR, or do you say the whole thing? Like, what's your like branding around that? That's the first question.
It depends. Sometimes, like whenever I answer the phone, I answer it, thank you for calling Integrated Sports Spine and Rehab. How can I help you? Like if I like my receptionist's away, but like online, like, a lot of times, you just say integrated SSR, it's faster. People who already know,
Sure.
they, in emails, you know what I mean? Like, we say integrated SSR. It just, it's easier. People get it. They know what they know what we're talking about.
Yeah.
But like if you, somebody for the first time, like never even hearing about you, like they have no idea what integrated SSR is or what's SSR.
Right. So your practice is known for, holistic, even that self-management approach, which is a little different from some of the traditional chiropractic practices out there, like the come in, get an adjustment and leave. You have certain franchises that advertise that. It's like conveyor belt type situation. That's not you guys, at least not from what I understand.
No.
How do you convey that difference to potential patients?
The difference is this. Sometimes people are thirsty, and when they're thirsty, they just want a glass of water, and that's fine. And it doesn't matter what kind of water. They just want the water, and that's fine. There's nothing wrong with that. But there are sometimes people are thirsty, and they're also hungry, and they want something that isn't just water. They would like to have, like a glass of lemonade with that water, and would like to have, a meal also, you know what I mean? Like they would like to have a salad, or they would like to have like a sandwich or something. And that's the difference. There's nothing wrong with quenching your thirst, but like your stomach is growling, you know what I mean? Water's not going to cut it. Like you gotta fill it with something else. And not only that, you can also have nothing besides water, you know what I mean?
Yes. You have a very strong online presence, using social media, digital resources, etc., to educate and engage really your patients. How has, leveraging those digital tools helped you grow your practice, educate more people about the non-surgical rehab options, which we're not saying surgery isn't ever an option. We're saying there is an approach, that we can possibly,
it's the last option,
not get the surgery if not needed. It should be the last option. Like in my kid's situation with their scoliosis, we were told, let's get the curve, get out to 50 degrees, and then we'll do surgery. No, that's not an option. There's ways of us preventing surgery. So like, how has leveraging those tools helped you grow your practice and bringing people to the table with that as a good preconception walking into your door?
Man, I think when you are able to present the difference between you and, everybody else, that helps, because it's not like a shotgun approach to try to get every lead possible. You want people who, well, at least for me, I don't want everybody. I don't want people who don't need to see me or don't want to see me or, are feeling like I'm looking for this specific thing. Because whenever they have like a certain preconceived notion of what it is that I'm doing or what it is that they're wanting or whatever, then it just becomes a bad referral or a bad lead because they're wanting a certain thing that I don't provide. I'm just not going to satisfy them. If I'm able to kind of like, showcase what it is that we do, then, and if that kind of interests people, like they're seeing it and, they're reading about it or whatever, and that interests people, then they'll come. You know what I mean? But earlier in my days is I would bash like, other like, therapies or modalities or, perspectives and stuff like that. I don't really do that much anymore. And the reason why is just because, you just look at the research and it just shows that the vast majority of people are helping regardless of what it is.
Outside of the kind of digital marketing piece and how you present yourself, still using the digital aspect, patient success stories are a big deal.
Yeah.
They build trust. They build trust. How do you share success stories while really maintaining obviously patient privacy and keeping things authentic?
So something I was struggling with was, just getting enough like new patients in the door. And it was just, we were really good at getting people better quickly. And so like on average, I think like the industry standard is like 20 to 30 visits per patient, right? And we would see patients on average of 8 times before they were 100% better. And so it was hard for me to kind of justify, okay, cool. I told you that I would get you feeling better. Now you're feeling better, but now I need you to just keep coming in regardless of if you're feeling
Right.
better or not. It's a hard sell for people. So I
Yeah.
just wouldn't do it. I would just kind of, let them know, hey, you have this option of, continuing, the care that you've been getting.
Sure. Yeah.
Insurance won't cover it anymore, but it's something that we can do. But also you can come back whenever something else kind of springs up. And
Hmm.
it wasn't, as you can kind of guess, like that's, you're kind of like working yourself out of a job. You know what I mean? Like if you don't, like
In a
we
good way.
make
Yeah.
money off of how many visits you have. You know what I mean? Like we make
Sure.
money off of
Yeah.
that. And if
Yeah.
I get patients to
Yeah.
like fewer visit, I'm working myself out of a job.
Yeah.
I'm working myself out of money. So
Yeah.
the advice I was given was, why don't you just like, the patients that are already like 50% better, like after like visit one, or like, like they're already 75% better in like a week. Why don't you just, ask them if they would feel like comfortable giving you a video testimonial? Just grab your phone up in their face, say, hey, would you mind, giving a video testimonial for like social media purposes?
That's
And
perfect. Yep.
don't give them any pressure. And something I always want to make sure I do is I always make sure that they understand no pressure. You don't have to say yes. Don't feel obligated. We just want to try to, share your story so that we can try to get more patients out there, because there are a whole bunch of people going to other clinics who are still dealing with the same problems that you came in with, and they don't know that we exist. And, maybe your video may make them think, hey, you know what? I'm going to give that place a try. And
Yeah.
so, I just present it, very casually. Something that, I've learned is like, if you feel uncomfortable about something and you show that you're uncomfortable about it, it makes people feel uncomfortable. And so,
Mm.
if you can just like treat it like it's no big deal, and just kind of like, "Oh, I've been here a million times. I mean, whatever. People feel a lot more comfortable. Hey, we're doing this. We're trying to boost our social media a little bit. Would you mind giving a video testimonial?"
Yeah. Yeah. So in the interest of time, Dr. Mozafari, I had like a few more questions for you, but I
Sure,
also
go
want to
for it.
respect your time. I just want to close this out, but I do have a couple more questions.
Yeah,
Maybe
let's
the
do it.
next time you're on, we can talk about the future of chiropractic and
Sure.
discuss the. I really want to focus. Maybe the next time you're on, we'll talk about the self efficacy piece. I think
Yeah.
we could talk for quite a while on that alone. So we'll touch on that in the next podcast episode. But after years of helping patients recover and optimize their performance, what's been the most personally rewarding part of your career?
Um, I think it's an intersection. One has been helping out the town that raised me. Whenever I moved back, I opened up in my town, and it's something that I, just really wanted to do is help out my hometown. But honestly, there's a selfish part of me that says the most rewarding thing for me is whenever patients come in feeling kind of hopeless because they've gone to, like 2 different pain management clinics. They've been to 2 different orthopedists. They've gone to 2 different physical therapy clinics. They've gone to 3 different chiropractors, and they're still dealing with pain. And I'm able to get them out of pain in like 1 or 2 visits. And it's like and literally what they say is, how did you do that? Like, how did you do that? You're a magician. One person gave me a water bottle and said, here, turn this into wine. And I was like, listen, I'm Middle Eastern. I got a beard. That's not me though.
Wrong guy.
Not that one. Wrong guy.
I love that. Yeah, that sounds fulfilling, man. I love. Thank you for sharing that, honestly. But I need your help here. I want to get out one key message.
Sure.
We want to tell the listeners. We want to give them one takeaway from this conversation. We talked about quite a few things, but one takeaway from this message. What do you think that one thing should be? Outside of you turning water into wine, because we know that's not going to happen.
Yeah, right. Yeah. The one thing that I think that people should recognize is that whenever they're dealing with a situation where they're dealing with neck pain, back pain, whatever, and they're suddenly like spasmed out, or that they feel like they are unable to do something, I want them to recognize that it'll be okay, that they do not need surgery. The risk, there's only 2.5% to 3% of people who deal with like a herniated disc, like a bad herniated disc. Those are the ones who need surgery. And most likely we're talking 2.5%, 3% of people of a certain population of people who are dealing with back pain. Right. So incredibly better. And it was the right thing for them. So they will be able to recover. They will be able to continue to do the things that they enjoy. They will be able to heal. Disc herniations heal over time. The vast majority of them do. Some 66 or so % spontaneously heal within weeks. It will be okay. Just make sure that you work on some of those healthy tips that I gave earlier in the episode.
Gotcha. Well, Dr. Mozafari, thank you. Thank you so much for hanging out with me and dropping those knowledge bombs. I really appreciate your time today.
Yeah, absolutely. Yeah, thanks for having me.
Yeah, man, this has been fun. Yeah, no, this is great. And we'll have you back again. We'll get a little bit deeper next time. Folks, Dr. Bobby Mozafari, proving once again that spines are like Wi-Fi signals, stronger when properly aligned. I know they're terrible dad jokes. A big thanks to Dr. Mozafari for sharing his wisdom and for not judging the fact that I currently have the posture of a pretzel. If today's episode taught you anything, it's that chiropractic care isn't just for when you throw your back out, reaching for the TV remote. But hey, if that's you, he's got your back, literally. So if you want to learn more about integrated sports spine and rehab, or if you just need someone to confirm that your spine should not sound like bubble wrap, check out the links in the show notes. Until next time, keep your head up, your shoulders back, and remember, if you hear a pop, that wasn't intentional. It's probably time to book an appointment. See you next time on Beyond Adjustments.